Hey, Dr. Kanko. The public health behavior issue that I wanted to address was COVID-19 mitigation behavior. Among all the countries in the world, according to the Worldometer, the US ranks at the top when it comes to COVID-19 cases, when it comes to total COVID-19 cases and new cases, as a matter of fact. When I say COVID-19 mitigation behavior, I'm referring to doing things like mask wearing, hand washing, social distancing, staying away from large groups, basically taking actions that will help you that will lower the chances of you contracting COVID-19. And the target population that I wanted to address was young adults, mainly aged 18 to 29. The reason I decided to target young adults was the fact that young adults, like, they're the ones who are typically the most reckless and probably show the least amount of concern when it comes to COVID-19 due to them, due to the chances of them, experiencing a severe reaction, being significantly lower compared to more at risk populations such as the elderly. So, some benefits of wearing masks can include source control to block exhaled viruses. According to the CDC, cloth masks can block most large droplets, 20 to 13 microns or larger, and they can also block the exhalation of fine droplets and particles smaller than 10 microns. And they also display upwards of 80% blockage, which has been achieved in human experiments that have measured blocking of all respiratory droplets. Another benefit is filtration for personal protection. Studies have demonstrated that cloth mask materials can also reduce wearers' exposures to infectious droplets through filtration. Multiple layers of cloth with higher thread counts have demonstrated superior performance compared to single layers of cloth with lower thread counts, in some cases filtering nearly 50% of fine particles less than 1 micron. According to a COVID-19 impact survey, that was conducted by the CDC. It was collected it in the COVID impact survey. They collected data to provide national estimates of health, economic, and social well-being of U.S. adults. The respondents were asked of the measures they've taken in response to the coronavirus pandemic. Questions included mask wearing, hand washing, social distancing, etc. During April to June 2020, during their report during that time, the prevalence of these behaviors was lowest among young adults aged 18 to 29 years old, and it was the highest among those aged greater than 60 years old. Even though mask wearing appears to have increased over time overall, other reported mitigation behaviors such as hand washing, social distancing, etc., has decreased or remained unchanged. So the reason I suspected this is that, like I said before, young adults, they believe that they aren't, like, the chances of them experiencing a severe reaction is so little, not to mention the high survival rate of COVID-19. They believe that going through these measures to protect themselves is like a waste of time. The theories and models that I'll be using it will be the health belief model and the theory of planned behavior. And through the health belief model, I'll be going through the constructs. First, in perceived susceptibility, young adults are typically aware of how contagious COVID-19 is. They may feel that they have already had it. If they hadn't gotten it already, they may feel like they will